Alrighty. Hello, everybody, and welcome to another one of our Facebook chats. I'm Sophia Grallert. I'm a client services specialist at the Dempsey Center in Lewiston, which means I am the front desk face. If you are to come into our center after we reopen our physical centers, you'll see me sitting there at the desk. I'm here today with Kathleen Wing, who is a massage therapist here at our Dempsey Center Lewiston location. Kathleen, would you like to introduce yourself?
Sure. I am the Complementary Therapies manager. I manage 3 service lines for the Dempsey Center: our oncology massage therapy, our community acupuncture, and our Reiki services. I work with a dedicated group of staff, contractors, and volunteers to deliver these services. And my job is also to ensure that the way we deliver these services is evidence-informed, so that we can do our best to safely and effectively support people living with cancer and their loved ones. My background includes experiences in international health settings, and also building a successful massage therapy business in Maine during and after the 2008 recession. I started with the Dempsey Center in 2013. Yeah.
All right. So kind of jumping right in, how did you come to be doing this work? How did you find the Dempsey Center?
Yeah, well, I have had a personal fascination with ancient and indigenous and folk medicine systems and how they evolve over time. And I'm also fascinated by what Western medicine knows or wants to discover about mechanisms of healing in those systems. So I did some college level work around those kinds of topics. I did some international health work with that kind of in the back of my mind. I became a massage therapist and decided to focus my massage therapy practice on working with folks who are going through cancer. And then found my way to the Dempsey Center after that.
Okay, so how does massage therapy help people who have cancer?
So research suggests that massage therapy may be helpful for common symptoms and side effects of cancer, including pain, anxiety, fatigue, insomnia, nausea, and depression. Our clients frequently tell us how impactful it is to them just to feel good for a little while. And they tell us that it gives them a chance to deeply relax and to take a break from the experience of managing the cancer-related pieces of their lives for a little while.
Yeah, just sitting at the front desk and watching people come out of their massages, it's just a joy to see them have them. You know, they come out and they're just, you can see the weight taken off their shoulders. So even if it's not doing any physical help, it's good for a lot of different reasons.
Yeah.
So say I'm a person living with cancer. What do I need to think about if I'm considering trying a massage for the first time?
Yeah, so at the Dempsey Center, we offer oncology massage therapy. And that means that we have a lens that we use to evaluate and adjust our massage therapy techniques in order to provide a safe and a helpful session for any person with a cancer diagnosis. Our massage therapists have additional training in oncology massage and related topics like scar tissue management, in addition to their basic massage therapy education. So I think when you're a person living with cancer and thinking about trying massage for the first time, it's important to find a massage therapist who has completed what we call a foundational course in oncology massage therapy. It's also good to know that massage can be used before you start cancer treatment. It can be used during your cancer treatment, and it can be used after your cancer treatment. So if you're thinking about it for the first time, under normal circumstances, any of those periods of your treatment would be fine to work with someone who is trained in oncology massage.
Awesome. And we also, I know from working at the front desk, we also have your oncologist's permission before we actually give that massage. We want to make sure that it's safe all the way through.
Yeah, so we're in communication with the physician's office to ask them about what we call contraindications, any conditions that would make it unsafe for us to perform a massage. So that's sort of one layer of protection, but we also have a lot of training around doing a thorough health history with the person in front of us and seeing if anything's changed since we got that initial, go ahead from the physician. So we do open up discussion and a two-way communication with the physician to make sure that everything we're doing is safe, that they're aware of what we're doing, and that it's appropriate for the person at that time.
Yes, definitely. And for anyone watching right now, I just want to let you know that if you have any questions for Kathleen, you can pop them in our comments section and we'll make sure to get to them by the end. So Kathleen, I know a lot of places that offer massage are still closed right now because of the COVID pandemic. What guidance would you offer someone who really wants to get a massage when that therapy becomes an option for them?
Yeah, so this is a really big question, and I'm going to do my best with it. And I'm going to start by saying that massage therapists are making very personal decisions right now due to some unclear guidance from the state of Maine. There's a little gray area there. And there's some gray area from the massage profession as well. And I think it's evolving, it's being worked out. But in the meanwhile, there's some gray area and there are decisions to be made. So those personal decisions look different from practice to practice. Those decisions are evolving as the pandemic situation evolves. So I want to start out by saying that I respect a massage therapist's right to work or to draw unemployment in the absence of work. And I respect the therapist and the client's rights to both be safe in the context of that work. So when I think about the question of sort of what guidance would someone want, what would they want to know if they really want to get a massage? I think about principles to consider. And I think about this both from the perspective of myself as someone who enjoys getting massage and can't wait for my next one. And I think about this from my professional duties and responsibilities as a licensed massage therapist. And I also think about this as someone who interacts with the community where people are living with cancer, and that impacts their bodies or their loved ones' bodies in a lot of different ways. So there are a few concepts or principles that I think about, and I'll go through a couple of them. One principle is the likelihood of exposure. There is no public setting right now that can provide a 100% guarantee that you will not be exposed to the virus. Massage is a public setting. A massage practice is a public setting. The therapist brings every space that he or she has moved through into the room with them when they come to a session. The client before you brings every space he or she has moved through with them when they come to a session. The client after you is going to do the same thing. Even in states like the state of Maine, where we have relatively low counts of total cases of COVID-19, we are seeing outbreaks. We are seeing loss of life due to the virus. We are living with the reality that many people from different areas of the country are about to come to our state to enjoy the summer. And we don't know what that's going to mean for our case counts in the months to come. So those are some things to consider around the likelihood of exposure when you're thinking about this. Another principle to think about is the principle of contact and social distancing recommendations. So this virus spread through contact with droplets that contain the virus. Social distancing is still recommended in addition to hand washing, covering your sneezes, cleaning. Those are the best ways to reduce the likelihood of transmission, staying physically apart. Massage therapy is an activity that requires close contact, an arm's length, for an extended period of time. And really, it's the opposite of the social distancing recommendation, right? So participating in an activity like this carries risk for both the licensed massage therapist and the client. So that's something to consider. Another principle to think about is risk tolerance. Massage therapists are people. Massage therapists are people with personal thresholds for risk. And their personal thresholds for risk span a spectrum from I always engage in low risk activities to I frequently engage in activities where there's high risk of transmission. That's what I'm talking about. Does that make sense?
Yeah, yeah.
Clients are people too. And clients are people with personal thresholds for risk. And I think both sides of that are important principles to remember and to think about right now. Another principle is the principle of infection control. So infection control is a set of practices that seek to reduce risk of transmission of infection. And we already know about hand washing. We do it all the time, and hand sanitizing. We cover our coughs and sneezes. In certain settings, they use personal protective equipment, and they use cleaning products appropriately to clean and disinfect spaces. Those practices are all effective at reducing risk of transmission. They do not eliminate the risk of transmission. And I think that's an important distinction. Massage therapists and clients are relying on these practices heavily to justify their ability to reopen or to remain open. You know, I'm good, I've got my checklist, I know I'm going to clean my space, I'm going to keep this really clean, it's going to be fine. It's important to stress, I really appreciate the amount of thought and consideration and effort that's going into creating those things. We are going to need them going forward. It's also important to stress that even the most thorough infection control measures do not eliminate the risk of transmission. They can only decrease. Okay, and I've got two more that I just want to highlight. One is the concept of asymptomatic transmission. So remember that the risk is not simply of contracting COVID yourself. The larger risk is me or you becoming an asymptomatic carrier of the virus and unknowingly spreading the virus to other people. Those other people include your family, my family, healthcare workers, first responders, family members of somebody else who's not healthy at home, and that person could suffer serious complications. The ripples can be pretty broad. And data shows that you can expose 3 or more people, other people, to the virus before you even realize that you're sick. So that's something to consider as we think about engaging in this activity. And then the last thing to consider is, what are the stakes? Like, what's at stake? We're talking about a pandemic situation, where we're experiencing life in light of a virus. And the virus is highly contagious. It's currently untreatable. It causes effects in the body that lead to serious health complications and death, particularly in people who are older, folks who have long-term health issues that they manage, and in folks who don't have a healthy immune system. So according to US Census estimates, about 20 to 21% of Mainers are above the age of 65. That's 1 in 5 Maine residents.
Wow.
If transmission occurs, the stakes are very high. So I just want to put that out there. There's more to thinking about it, but those are some of the important things that I'm thinking about as I weigh that decision about whether or not to return to the massage table. I can't make that decision for anyone else. It's up to everyone to do what feels best for them. But I hope that outlining some of those things that we need to consider is helpful to inform other people's decisions.
Definitely, yeah. So if I'm someone who isn't willing to make that risk, is there anything that I could do for myself while waiting for a massage to be available again?
Yes, absolutely. And even if you're like, no, I'm healthy, and if you're one of those high risk people and you're like, I desperately need my massage, I'm going to go do it. Like, I have a high risk tolerance. If that's what you choose, I would just say to anyone tuning in who's considering going back, consider those principles I just mentioned. Most of them point to the conclusion that accessing massage at this time carries a considerable amount of risk, And from that perspective, the conclusion I draw is that this is not the right time for me to pursue massage, even though I could really, really, really use one right now. And I'm sure many people watching could too. What we want to see later on when the time is right, we want to watch for consistently low case counts. We want to watch for constant decreasing reports of new cases. We want to watch for widespread testing becoming available. We want to watch for vaccines being available and being used. Those things are all going to take some time, right? So everyone needs some strategies between now and then, okay? So one thing that you can do, as I was reflecting on this question of sort of how do you do massage when there's no massage, when you can't walk into the room, I thought to myself, well, what is it about the massage? You know what? I would encourage someone to identify their specific need and look for other ways to address it. So what does massage actually do for you? Do you seek it out when you need a mental break? And if that's the case, would something like a guided meditation help to give you that mental break? Going for a walk, being out of your space, if that's safe for you, does that help? Do you need someone to touch your body with care and tenderness? Is that what you miss? If so, you could ask a loved one for a foot rub or a shoulder rub or a head massage. And if your loved one says, I don't know how to do that, I'm not good at that, then you can keep your eyes peeled on the Dempsey Center programs list for a virtual partner massage instruction that's coming up soon. Okay, so I'll talk more about that in a minute too. Another, as I'm thinking about why do people come in for massage to begin with? Are you in pain? If you're in pain, reach out to your healthcare providers for input. I have cared for some good, stoic New Englanders who go through each day in really a tremendous amount of discomfort. And it does not have to be that way. You can have a conversation with a healthcare provider about strategies that would benefit you and ask them about what activities are safe for you. You can also, people can go to Dempsey Connects, to the Dempsey Connects portion of the Dempsey Center website. And there you can find some great resources that you can use from home. There are resources for stress management, and that includes some of our meditation and body practice pieces. There are resources for movement and fitness if you need to move your body, whether that's at an intermediate level, at a beginner level, there's all kinds of levels there. There's nutrition information, education on cancer-related topics, grief and loss resources, youth and family resources. There's a lot there. The Dempsey Center staff spent some time at the beginning of the pandemic really thoughtfully compiling things that we thought would help to make life better for you at home. So please, please, please take advantage of those things. And let us know if you're looking for something there and you don't see it. If there's something else that you want, if there's something else that you need or you're not finding, we would be happy to go looking for it and find quality content and add it to that page. Or if we can't find it, we would be happy to create it ourselves if we need to. So if anyone out there watching has suggestions, you can send your suggestions to info@dempseycenter.org, and we would be happy to pick it up and run with it from there. My two other thoughts for what do we do in the meantime are to have patience. I can say from experience that your massage therapist is missing you terribly right now. And working with you and helping you feel better is why we do what we do. And we are feeling all the feelings about not being able to do our good work right now. So we'll both try to have patience. And then lastly, connect. If you miss your massage therapist, reach out. I am positive that they would love to hear from you. I love to hear from my clients. And if my client has an issue, I might be able to recommend some self-care that might help right over the phone. Or send something in an email that might be useful or helpful. It's not a massage, but it is something, and it might be able to help. And sometimes it's that connection that we're both missing. And after the call, we both walk away feeling lighter. And that connection is another beautiful thing that massage therapy does for us. So those are my thoughts about what to do between now and then.
Awesome. I'm going to use some of those suggestions as well.
Wonderful.
All right. Well, I have one more question, and then we have a couple different questions from our viewers. But first, let's. I think you covered some of this already, but are there resources that you would recommend for anyone who wants to know more?
Yeah, so there are just a couple. For someone who's brand new, has a cancer diagnosis and is looking at moving forward into massage, there's a lot of good information at the Society for Oncology Massage's website. It's a professional affiliation of massage therapists who specialize in oncology massage. So their website is www.s4, the number 4, om.org. There's also, like I mentioned a little while ago, our Dempsey Center website has tons of content, and some of it might, it won't do what a massage will do for you, but it might help get you between now and then. So our website is www.dempseycenter.org. And within that website, there's a Dempsey Connects section, and you'll see this warm, wonderful scarf and somebody typing on a computer. That's the one you want to click on to go and access that content. And if you're unsure or you have concerns, really, in terms of resources, communicate with your healthcare provider. Ask them if they, what they think, if they would recommend it. They are happy to hear from you, and they are happy to help you figure out how to get what you need and stay safe.
Definitely. And just for our viewers to know, we have posted the link to the Oncology Massage website that Kathleen mentioned. So if you want to check that out, it's right in our comments. You should do that. So moving on to some viewer questions, Kathleen. Someone's asking, are there any massage therapy places open in Maine right now? And how would we find out which ones are open? Is there a listing online?
Yeah, that's a good question. I know that there are, and I don't know the best way to find out who's open and who's not at this time. I think probably it's sort of practice by practice. And unfortunately, there's not one clearinghouse that shows you, here's everyone that's open and here's everyone that's not. I will say that from a perspective of Maine massage therapy, I'll just explain this for people who are curious. The state of Maine categorizes most massage therapists as the types of employees or the types of businesses that would be consistent with a phase 3 reopening. And just so you remember, we're sort of in phase 2 right now, but even that's kind of limited. So nobody in phase 3 should really be operating right now. The gray area is that some massage therapists consider themselves healthcare providers. And there's a different set of standards for healthcare providers. And some massage therapists, I think, have petitioned the state to be able to practice as a healthcare provider and taking the precautions that are recommended for healthcare providers. So just so savvy clients are aware, that's the environment that we find ourselves in right now. There's kind of a double standard. There's gray area, and I think it's a consumer proceed with caution kind of environment. If you have worked with someone forever and you both feel comfortable with the amount of risk that you're taking on, use that to inform your decision. If you're getting regular emails from your practice that says, here, we've got our checklist in place, we're ready to go, that's up to you to decide what you want to do. As I think I've stated already in this talk, that doesn't make me feel comfortable yet because of some of the principles and concerns that I've outlined. But I leave it to you what level of risk you're comfortable with.
That's some great advice. We have one final question from our viewers, and this one's pretty specific. Are there any self-massage recommendations for tightness and pain while we're home?
Sure. We actually had a program about this just a little while ago. We had a Zoom class about self-massage that our wonderful Maggie Miller led. And it was such a hit that she called back for a repeat class not too long after. And that just happened last week, I think. So that one might become a regular offering. I don't know. We might need to move it to like a weekly rotation. But I mean, I'll just sample you can do a lot for yourself. It depends on where your tightness is, but a lot of times just bringing even the weight of your hands to different places. The head is usually such a good place to start. Doing your own little scalp massage, you know, that awesome scalp massage that you get when you go to the hairdresser. Do that for yourself. Now I've got my hair all over the place, but you know, go ahead and do that for yourself. It feels good. Take care of your own feet. You know, if it's comfortable for you to put one leg up on top of the other and to press, let me get into the camera here, and to press your thumbs or to gently rotate your hand into the bottom of your foot, or use a tennis ball, something that sort of has some firmness but some softness to it as well. That can feel really good. You know, even a can, if you've got canned goods in your pantry still that you haven't tapped into yet from sheltering at home, roll out a can of something and roll it under your feet. It feels wonderful. And then if it's safe for you, doing some gentle, for most people, this is pretty safe, just to do some squeeze and release, right along here, right in the trap, right between your neck and your shoulder. Just if you can reach there comfortably, just doing a little squeeze and release. And when you're done, bring your ears up and then just drop them. Bring your shoulders up to your ears and then drop them down. And kind of feel that length in there. Even just those little things can kind of help reset. You know, what I hear the most is low back tension and neck tension are usually the two places people most want me to focus on. So this one's good for that neck tension. And for low back, you know, I think heat can sometimes do a lot. Having a warm bath, a warm shower, you know, just taking the time to do that, or to apply a heat pad if that's appropriate for you. Those are some things to consider in terms of self-care, relaxing and loosening those muscles. And if you wanted to, if you don't have a lot of bruising risk, and if it's comfortable for you to reach around back, you could even kind of tap your low back and tap some of those muscles that are feeling stiff or sore. And that might be a way to kind of, that kind of tapping often helps the muscles sort of release and relax a little bit. So those are a few thoughts.
Awesome. Well, that is some great advice. And for anyone who's at home missing their massages and you're not ready to venture out just yet, these are some great tips. Thank you so much, Kathleen, for joining us.
Thank you for having me.
And as she mentioned, if you check out our website, dempseycenter.org, we have a bunch of different resources, both on massage. We have some classes that have been happening, self-taught massage, partner massage, as well as some other resources, nutrition, fitness, counseling, things like that. So definitely make sure to check out our website at dempseycenter.org. Again, we will be doing these Facebook Live interviews every Thursday at 1 o'clock, so make sure to join us next week. You can turn on your notifications and make sure you comment and follow so that you know when we're going live next. Kathleen, thank you so much. I'm definitely going to be using these tips for myself, and I can't wait to see you in person again.
I know, right? Okay, take good care, everybody.
Thank you so much, everybody.